We're at the 2017 CROI. We're here with the chair of the conference, Susan Buchbinder, who has been so involved in prevention over the years, San Francisco and early trials. It's just fabulous to have you here, number one, and number two, you're the chair of the conference this year. So we appreciate your giving us the background on what the conference is today. It's become so diverse, so expanded in all the categories. I know you can't probably give the exact numbers and everything, but give us a sense of it.
Sure. So we have over 1,000 presentations of one sort or another, only 96 oral presentations. So we've got fairly limited number of oral abstract presentations. Then we've got symposia, 3 symposia per day that are getting into more depth, giving longer presentations that are overviews of a specific field. So for instance, this afternoon there's one on sexually transmitted infections and various aspects of sexually transmitted infections. So not single studies, but rather an overview of an entire topic. And then there are posters, and we pull posters into theme discussions, and I believe we have something like 14 theme discussions this year, where 4 or 5 posters are presented en masse, and then there's a more in-depth conversation about it. So for instance, there was one today on novel methods for delivering PrEP or delivering HIV testing through pharmacies using SMS texting, communication, and a variety of other kinds of aspects. So that's been great. And I'll just say that since 1993, which was the first year of the conference has really expanded so that there's a much more international perspective on things now. Previously, epidemiology and prevention were very small components of the meeting, and now they're very major components of the meeting. And the clinical component of things has really stretched to include all kinds of complications, as well as the viral hepatitis and emerging infectious diseases. So this year there's a theme discussion on Zika. So there really is a much broader perspective, but it is one of the unique components of this meeting is that it brings together everyone from the basic scientists through the clinicians, through the public health epidemiology folks, to make it truly translational so that we can take all that we're learning about HIV, pathogenesis, transmission, prevention, treatment, and bring everybody together for a common conversation.
Yeah, it's all about combining the disciplines and getting them all on the same page.
Yes.
And that's what the conference does. I mean, if you're down your narrow focus at your bench science or your clinic or whatever, but here it's a great opportunity to explore your vision of what it is. And we're talking, thousands of doctors here.
Yes.
Getting the chance to talk one-on-one.
That's right.
You know, I had a lot of people said to me in the old days or not the old days, but the days when it was changing to electronics, and we can't do this from a distance. Some people can manage it, but the conference the core has to happen here in a space. And
we unfortunately we have a cap of about 4,000 people who attend CROI because we want to keep it to be a somewhat more intimate setting. And yet with that 4,000, as I said, we've got basic scientists, we've got clinicians, we've got public health epidemiology folks, we've got prevention and treatment, and about 40% of our registrants come from outside of the United States. So it really is an international conference, 90 countries represented at this conference.
Well, I'm excited about the conference. It's relatively new, and we're excited about you being here to help us elucidate what this is about.
I'm always happy to do this, and I really appreciate that you do this and that you make the conference accessible to a much broader audience.
Exactly. Thank you very much.
Yes.